This is Dr. Hamdoon Naamani. I'm an ENT consultant at AlNaamani Hospital from Sultanate of Oman. And this morning we had a panel discussion on the CT scan findings that predict or warrants a difficult FES. And during the panel discussion, we have elaborated on basically 6 essential items that we think will cause or will predict a difficult FES surgery. The first one was the variant anatomy, like concavalosa, septal deviation with the spur, and Haller cells or Onodi cells. All these variation can predict a difficult FES in terms of injury to critical structure, like the Onodi cells. The critical structure is the optic nerve, and Haller cells will cause a narrow in the maxillary sinus entry. So we always need to be careful in that area, especially it is in close proximity with the optic or with the lamina papration. The second important part was on extension of the disease. As we all know that we rely on Land-McKay scales to identify the severity of the disease, and it's well known that more than 12 scores will predict a difficult surgery in terms of prolonged surgery, in terms of more chance of bleeding and subsequent intraoperative complications. The third important factor is revision surgery. We know that if you get a patient with a CT scan that is he has a lost anatomy, for example, middle terminate, which is considered the vital landmark, you are going to encounter a difficult surgery, definitely. The fourth important factor, or a predictor, I can say, is orbital or skull base anatomy. We rely on Quiros classification in identifying the length or the risk of penetrating the skull base. So we mentioned that Quiros classification of type 3, which is more than 8 millimeter, that is considered having a higher risk and a difficult surgery. And also, if we have dehiscence in the lamina papration or in the skull base or in the other sinuses also, this will warrant a difficult surgery. The fifth point was if you encounter bony lesions in the sinuses, for example, osteomas or fibrous dysplasia, these surgeries will take you long because of the drilling that is required to remove. So the surgery will be very long, the amount of bleeding will be extensive, and the risk of bleeding, the risk of complications is higher in these cases. And lastly is the frontal sinus outflow. We know that the narrower the flow, the difficult the access to the frontal sinus, especially if you have supraethmoidal cells, more than 2 cells, or if you have frontal sinus cells that reach up to the middle of the frontal sinus, or if you have a huge over-pneumatized frontal sinuses that will have a difficult access to those areas. So basically these are the 6 important predictors that we have discussed extensively this morning, and I hope you got some information and elaboration about them.